We have seen hospitalizations triple across the board. We are able to care for the patients who are coming to us, but of course, we're concerned with the trend lines we're seeing.
The CEO of Houston Methodist Hospital talking about how his city is becoming a new COVID hotspot. Now check out these numbers. In just the past 24 hours, the city has seen 1,600 new cases. Of course, that a new record. That makes a total of more than 33,000 since the outbreak has began. And 5 Houston residents lost their lives in the past day. Nearly 500 have died since the virus has first surfaced. And now, an infectious disease expert at Baylor says Houston could be on track to be the worst impacted city in America and could even rival what we're seeing, get ready for this, in Brazil. And now some businesses that have reopened, they're shutting their doors again. That includes 7 Apple stores in Houston. And in response to the spike, a county judge recently issued a new order telling businesses to require face coverings for workers and for customers. I want to bring in our guest, Dan Solomon, he a writer for Texas Monthly. Dan, I appreciate the time, and I wonder, because when we were in New York, my wife works in the medical field, you could feel that palpable dread when hospital beds were starting to run out. People were talking about ventilators and the shortages of them, and the peak wasn't forecasted for weeks away, and at that point, that was really the first peak in this country. You didn't know where the end was going to be. Do you get that kind of dread from folks in Houston right now as to where is the bottom to this thing?
I mean, I think that people are starting to grasp it. You know, there's been kind of some magical thinking in Texas that maybe this just wouldn't be so bad here and that we might just kind of escape it. That was kind of a lot of what our reopening was based on, was the idea that maybe this would just, for reasons we don't understand, not have the same, spread or the same impact that we saw in New York or, northern Italy. And so I think people are starting to just begin to recognize, like, oh, this is going to be bad. This is, there's nothing that's different here than there was going on in other places.
The one thing New York and a lot of the northeastern states at least was, there was at least unity in terms of leadership. Both the mayor of New York City and the governor were on the same page that maybe they waited a little bit too long, but still they had to take dramatic action. There was no daylight between the two. Obviously a different story when you talk to Houston or Dallas mayors compared to what's going on in Austin from the governor. How much does that complicate it, Dan, is that you're getting mixed messages from the governor telling the cities they can't do what they want?
Well, that's been an issue so far, and it seems like it's changing a little bit in that the governor is giving county leaders or city officials, depending on how they're structured, the ability to enforce certain policies. The enforcement is still kind of weird. In Harris County, for instance, where Houston is, they can require that businesses require masks, but they can't require individuals to wear masks. So if you go into a Best Buy is required to make you wear a mask, but if you don't wear a mask, Best Buy is the one who gets the fine. So that kind of sets up an unusual dynamic in terms of who has the liability and how urged people will feel to comply. And then it's also, because it's on a county level, Harris County requires masks right now. Montgomery County, which is just north of Houston with several of the larger suburbs, doesn't require masks. And that's up to a county judge, which is an elected official, who just kind of has to decide that. So it's a patchwork of regulations right now that isn't consistent from place to place. But what we are seeing this week is at least that, the governor is leaving that power in the hands of local officials, whereas just even a couple of weeks ago, a couple of days ago, even that wasn't something that local officials felt empowered to do. The governor's orders were leading and superimposed over the local leaders.
In terms of capacity, I've heard a little bit of mixed messaging in Texas in terms of, how much PPE they have, how much ventilator space. Obviously, we're seeing even children's hospitals opening up beds now for adults. What's their take in terms of their bandwidth and what they can handle right now? How concerned are they that if this thing gets much worse here, we may be beyond capacity?
So right now, everything is okay in terms of capacity. Things are there's still enough space. There's a lot of hospitals in Texas, and probably throughout this there will be places. If we look at it statewide, we kind of get a skewed view of things. It doesn't matter for people in Dallas if there's a lot of hospital beds in Lubbock, and that's a thing that we have to be very mindful of. Is that we really need to be thinking about this much more in terms of the city or the county level, because there are 254 counties and it can take 12 hours to drive from one to the other. But right now, things are generally not overflowing or overwhelmed. It's just that we see this trajectory where, hospitalizations, every 2 weeks are doubling. So a month from now, we would be full. And that's the concern. It's not so much that today everything is full and people are going to be dying in the streets. It's that, we're not doing anything right now that would change that a month from now.
And that brings me, Dan, to the next point, which is, since we've been through this in the Northeast, the issue then becomes, well, what do we do? Well, we basically locked everything down and we had quarantine, and it wasn't an optional, and that's what obviously put us on the other side of the curve. You can't put the genie back in the bottle at this point. No one is even suggesting that that would even be accepted, let alone even proposed from the governor. So is that the biggest concern, that there's no magic bullet that people would really be willing to do? At best, maybe you'd see a time where there's mandated masks, and that's probably even pushing the envelope here. Is that the biggest concern, that no one's going to take that ultimate step here if the curve gets really bad?
I think we're going to have to figure that out. And, I've talked to officials and local officials in Austin who say that if and when, they reach a trigger point in Austin, it's 80 new hospitalizations a day, which is a clear sign that we are, about to be overrun. At that point, city officials say that they'll take action and shut down businesses and restart lockdown measures as they existed, in March and April. And it's a question of whether they have the power to do that. Nobody's quite sure, but that's kind of where things look like they'll end up right now. Perhaps there'll be a statewide order, but I think that more likely we'll see cities impose these orders, and then maybe the governor, who doesn't presumably want things to get worse, will just take a step back and not actively challenge those measures. But we don't know yet.
Well, I wish you the best of luck, Dan. I certainly appreciate you giving us a few minutes today. Thank you.
Thanks.
All right, everyone, when we come back, we're going to have a recap of last night's primary results. Also, we're going to discuss the latest presidential polls and how Biden's lead just keeps on growing.